Having knees too far apart or a lopsided pelvis can cause irritation of the pubic symphysis joint. In this video, we are going to go over tips and tricks to prevent symphysis pubis dysfunction in your most common daily activities in pregnancy and even in birth. Hey Fearless Mamas, so the three most common symptoms of SPD are pain in the front center of your pubic bone, pain in the perineum, and even people feel pain in lower back and groin area. So let me know in the comments below if that's something you are feeling. If it's something else, let us know in the comments below. But you're in the right spot because what I'm about to share with you is what I applied in my second pregnancy, along with weekly chiropractor appointments, but I am proud to say that I did not have any long-lasting pelvic pain throughout my entire pregnancy. With that being said, let's go over what that may look like in your everyday pregnancy activities. I don't know about you, but getting in and out of the car was extremely difficult and hard for me to do big and pregnant. So to get in the car, you want to back in the seat, aiming your bottom towards the seat. Then you want to pivot front and center with your knees together. So think mermaid. And I know that sounds difficult to pivot, so a cool little trick is to stick a silk pillowcase or even a grocery bag. Always have it in your car to help you slide in and out. The same goes for getting out of the car, but in reverse. Pivot your legs like a mermaid, knees together, and then plant your feet on the ground and lift up out of the car. Another very difficult thing for pregnant mamas, even if you don't have SPD, is learning how to properly get out of your bed and even how to roll over and switch sides in your bed. So getting out of your bed is pretty much the same concept as getting out of your car. But what you want to do is make sure you lay on your side and then aim your feet towards the ground, knees together like a mermaid, and then use your arm strength to push your upper body up out of the bed. Plant your feet and use your legs to stand completely up. As for rolling over in the bed, big and pregnant is super difficult. You don't want to let your spine twist in any way. You don't want your legs to come apart as you turn over, but you actually want to just kind of wiggle like a log and turn on your back and then to your other side. And what really helps is if you have silk bed sheets or silk pajamas to again help you pivot and slide. Another common thing that I see pregnant mamas do is standing out of alignment that can really strain that pelvic symphysis joint by irritating it and being lopsided. So really making sure not to drop and stand more on one leg, but to always be planted on 2 feet. Another thing to keep in mind is making sure that you're picking up things front and center. So you don't want to have a purse on big and pregnant, or hold your diaper bag on one arm, or hold your toddler on one hip, but you want to try to keep everything front and center. Use a backpack if you can, and hold your baby more in front with your arms. And making sure that your ribs are over your hips and your pelvis is not too far out and too far in, but just slightly tipped to hold your baby in a nice little hammock. If you're too big and pregnant, try to get your baby in a baby carrier in your back, or sit down if they are just demanding for you to hold them. Again, making sure not to pick up anything with one arm where it can make you dip to one side, which puts more pressure on one side of your hip than the other, causing an imbalance and a strain. Sitting in alignment is super important in late pregnancy as well, just to even get your baby in an optimal birthing position is pelvic posture. And sitting in alignment is something that we can do often, making sure that we're not tilted on one sits bone more than the other, and that we're not slouching on the couch, but planted on both sits bones evenly. And if you have a hard time sitting on the couch, make sure to scoot your bottom towards the edge of the couch, making sure our ribs are over our hips. And another cool tip is to make sure that your belly button is at least pointed horizontally straight out or aiming at the floor. Another easier way to sit is on an exercise ball or birthing ball and do the same concept, pointing your belly down and keeping your pelvis in correct alignment. And widen those legs to dip your belly in between. But again, making sure your knees are not widened too far. A good tip for that is knees lower than hips. And you can take your exercise ball to the dinner table if that helps you stay in alignment. Another great tip for resting smart or sleeping in pregnancy is to have a nice fluffy pillow in between your knees and your ankles. So a body pillow would be great for that, and just keep your leg a little bit past 90 degrees to just make sure that your hips are stacked one on top of the other. You may even need to get a little towel and bolster it under your side to help prop up your hips one on top of the other. Late in pregnancy, mamas definitely need help putting on their socks and shoes, so having a helper partner do that for you is wonderful. But a key to keeping your pelvis in alignment and not leaning on one leg, which can put strain on your pelvis and imbalance it, is to make sure that you're sitting down while getting dressed. So don't stand on one foot, try to slide your foot into pants and things like that. But make sure you are sitting properly on your sits bones and lifting one leg while you're sitting to get on those shoes and socks and things like that. And you may need to get creative with sexual activity. Without getting vulgar, let's just say think spooning or using a chair to get in certain positions that won't widen your legs too far. This goes for birth positions as well. You can prevent pubic symphysis dysfunction in birth by making sure that your knees stay even, making sure that people aren't helping you out and holding your legs uneven or pushing them out too far. Two of the best birth positions for SPD would be hands and knees positions, which you can totally do with an epidural, as well as side lying with your knees together, also epidural friendly. If you are walking, exercising, doing lunges, walking upstairs, just make sure to shorten your stride, shorten your steps. If you're walking up a step, do one step at a time, one foot, and then have your other foot meet the other foot, and then continue to the next step. Again, the goal is to make sure to prevent symphysis pubis dysfunction by avoiding your knees from becoming too far apart or your pelvis from becoming lopsided. And if it is, irritates the pubic symphysis joint. If you happen to feel like you did irritate your pelvis or pubic symphysis joint, you can give your pelvis enough time to naturally recover by resting in the hands and knees position and even taking the weight off your pelvis by being in the water, giving your pelvis a nice little break. Using a pregnancy belt would give your pelvis extra support by helping take some of the belly weight and strain off. But the best way to support your pelvis is to make sure that the surrounding muscles are nice and strong and balanced, strong enough to keep good pelvic alignment and help support that extra weight load of your growing belly and baby. I was super afraid that this would happen to me again because in my first pregnancy I had diastasis, which puts you at a lot more risk for developing SPD because of the widened and weakened core muscles, glute muscles, and pelvic floor muscles. So if you're feeling like that sounds a bit like you, I made sure to include strengthening all of those muscle groups in my 6 exercises to improve symphysis pubis dysfunction. So be sure to check out that video. My name is Dancee Pinkston. Thank you for watching and see you in the next video.